All right. Well, good afternoon to everyone. And I know we'll have a few other people probably joining us as we get started here, but wanted to welcome all of you to our UNM Health Sciences Office for Diversity, Equity, and Inclusion's Excellence Awards for Women's History Month. So on behalf of all of us at our Health and Health Sciences and our Office for DEI, we really thank you for taking the time to join us in this celebration. And just to let everyone know, the presentation will be recorded and then posted on our website for those who could not be here today. So as you know, we're here to celebrate really the culmination of what was an amazing Women's History Month. For those of you who could join us for many of the events that we had throughout the month. And of course, technically, it ended on March 31st, but again, we're taking the time today to celebrate this wonderful month and really honor the invaluable contributions of women right throughout history and here at the university and in New Mexico. So we're really to recognize their resilience, their leadership and achievements, and we'll hear about many of those today. One thing, and I'm not sure if people had known and if we talked about this at all, but this year's, every year there's a theme for National Women's Month, and this was Women Who Advocate for Equity, Diversity, and Inclusion. So really no better time to celebrate our outstanding awardees today right here at UNM. And really feel like the work and what you're going to hear about today embodies the strength and the legacy, right, of so many women who have come before and then those now, right, and really speaks to the vision of our health and health sciences and a place where we really proudly proclaim that diversity is our foremost strength. Again, can't wait to hear about the invaluable, all of us to share and celebrate these invaluable contributions today from our awardees, and they really serve as an inspiration to us here at UNM and beyond. So we will be celebrating the work of the following individuals, and I'll turn it over to each of these groups in turn, but honoring today Dr. Donna Sigel, also the AAMC UNM chapter of Group of Women in Medicine and Sciences, and Dr. Mingli Wang, and then Dr. Lina Aguirre, and then the Community Health Workers Initiative, which are presenting here today is Shonique Lynch and Javier Rios. So I am going to turn it over to Paul. Well, let's see, is Paula Hensley here? I know she had a clinic. Paula, are you? Yes, great. So I'm going to turn it over to you, Paula, as we celebrate Dr. Sigel. Thank you.
All right, thanks so much. I hope everyone can hear me. It seems like the connection might be a little unstable, but okay, great. So I just wanted to say briefly that I nominated Dr. Sigel. I've known her for almost 30 years. I interviewed her for residency, and I was so happy that she joined us. And so I'm not going to take credit for all she's done, but I'm glad I at least saw the potential in her when she came through from Arkansas. And we've just been so blessed to have her for all these years. So currently, I'll just say just a few things that I wrote in my nomination. Dr. Sigel serves as the Senior Associate Dean for Faculty Affairs and Career Development. And she has always advocated for diversity, equity, and inclusion throughout her entire career, advocating for us as faculty members, advocating for her patients, making sure that we're always, considering the social determinants of health when we're treating people. And she is a child psychiatrist, so she works with some patients who are just really in need of her services. We need many more people, and once we figure out how to clone people, I think Dr. Sigel should be right up there in our numbers of people we need to clone. So she really, I think when I heard about this award, I asked one of our admin assistants, the lady who works with HR, and I asked, about her, and we were trying to get her CV because if you know Donna at all, she does not like to toot her own horn. And I asked her for her CV, and of course I did not get it. So I did an end run around her and got it, and talked to one of our staff members, and she said she really just asks the questions, making sure that we're always considering diversity, equity, inclusion in all our hiring decisions with our department and with other departments. She has presented at a national meeting a poster on why gender differences and why physicians leave organizations, and I think that work is is very interesting. And when I think about the reasons that people have left UNM, I think it can be very different along gender lines. So just being aware of that. She's had a number of very high leadership positions, and I just have the utmost respect for Dr. Siegel, and congratulations. I can't think of anyone more deserving of this award. Thank you.
Thank you so much, and congratulations, Donna and Dr. Siegel. We ask each of our awardees to share a little bit about their journey, right, to where they are here, and how they hope to continue serving, in this case, women at the health and health sciences and our greater community, and what this award means to you. So I will turn it over to each of our awardees, and we'll be speaking to that today as well. Thank you.
Thank you. Yeah. My journey to medicine started on a small farm, rural Oklahoma, wheat and cattle. And then I came by way of public accounting. That was my first career, where I worked as a CPA for an international accounting firm. Once I got into medicine, I think that the accounting experience was helpful for me because it gave me an entree into finance, and finance at the department level, at the hospital level. But I'll have to say that Dr. Hensley, Paula was really critical in my coming here to New Mexico. She not only interviewed me as I was interviewing for residencies, but made the point to call me and say, hey, we're interested, please consider us. And so I've not only had that support from the beginning from her, but also throughout my career as we're going to conferences or looking at other opportunities. Paula has really been an essential support, and one of those individuals who is always uplifting other women. And so the work, I guess the work I've done here, while I've been able to be in different leadership positions for as whether with the physicians advisory group or on the hospital board, I've always looked to see, can I elevate women? Can I put women in front of these groups to help them get the exposure that they need? Women who are doing exciting things in quality, in doing things with the state. So that's been one piece of what I've done. But also I got a lot of help putting together my CVs, and can I help other women who are struggling to put together their dossiers, women who maybe have additional time in rank and have not put together their dossiers, or were told that they needed publications or told that they needed different things that it's really not a criteria for the School of Medicine. And so that's been one of the rewarding things for me, is to work with individuals one-on-one who may be women, may be underrepresented, but haven't gotten the information or the support to understand and to know how to work through the system to get credit for the work they're doing, to get credit to be promoted, and credit to get the higher salaries. And so in the role I'm in now, which is Senior Associate Dean for Faculty Affairs, I have the opportunity to review every year equity with every hire that comes in, to look at equity for the faculty that are around those being hired, with every department, every division, every faculty, every year, to look and see, are these salaries equitable? To look at the data that we collect on our retention, and to say, yeah, as Paula said, are there reasons that women leave that are different from the reasons that men leave? Are women getting the awards the way that men get awards? And what can we do to help support women be more successful in writing letters of support for other women in how we elevate women? And so I'm really excited that Dr. Wang is starting our GWIMS, working to start the GWIMS, which will also be another venue, and looking to supporting her in that role. And so again, many thanks to Dr. Hensley for her nomination and her support through the years, and for my chair, Dr. Towan, who's also been very supportive of me and many endeavors that I've undertaken. And thank you, Dr. Romero-Leggett. I've known you for many years as well, and you've been such an inspiration.
Thank you so much, Donna. And we're just, again, so thrilled and proud and appreciative of everything that you've done for us. And I know that I have been a beneficiary as well with you as a leader and a colleague here, and things that you've done to elevate and help us as women in our academic careers here. And we know that what that means too for all of us here and all of these awardees is this means that we also benefit, right, our communities, our families, our daughters. I mean, this is far-reaching. So thank you so much. And we're taking the opportunity to open the floor. And please, if other people would like to say something, please go ahead. Yes, Dr. Towan, I see.
If I may add some words, I echo everything that Dr. Hensley mentioned, except I have not known Dr. Siegel for 30 years as she has. I've met her for, I guess, since I arrived at UNM 11 years ago. And I believe Dr. Siegel is the only vice chair that has been in the role for the past 11 years. Others have moved or left, and there's new folks. And I must say that the department has a lot to thank to Dr. Siegel. She clearly has made an impact in many ways. As you heard, she started as a CPA. And I always like to brag about our faculty. And every time I have the opportunity to introduce Dr. Siegel, I point out that in addition to being an outstanding psychiatrist, she's a CPA. I don't think there's another CPA in the School of Medicine who's also an MD. So that makes her quite unique. But her career is just really part of who she is. I think that our department, I would say, has been quite successful and stable, and we have a lot to thank to Dr. Siegel for that in two very important ways. One is, of course, the issue of DEI and looking after not only female faculty and staff and learners, but all kinds of diverse individuals in whatever way you want to look at it. But also on the financial. Thanks to Dr. Siegel, the department has been very stable. Our budgets have never been on the red, maybe for a little period of time, but then it's corrected. So that's a major contribution to the department. But in terms of DEI, sometimes folks would say, well, I am not sure if I have been treated fairly and if there's parity. And I always tell them, I know you have, because I know, thanks to Dr. Siegel, as she mentioned, she always makes sure that everybody gets the same opportunity. And certainly that populations that are sometimes disadvantaged, like females or any other kind of different populations, gender identity, gender choice, what have you, religion, lack thereof. But she always makes sure that there's parity in terms of salaries that were fair, not only to the individual, but also to the department. Like if we think of making an exception, she reminds me, well, you're gonna establish a precedent, and that's not necessarily good. So I really, Donna, Dr. Siegel, I really thank you for everything that you've done for the department. And for that matter, for me as the chair, ultimately I'm responsible, but as I've mentioned already a number of times, a lot of that we thank to you. Now, the good thing is that she is now a senior associate dean, and I'm very happy for that, because although she's only working for the department a small amount of her FTE, she is her talents and commitment benefits the whole School of Medicine, and we're always happy when one of our faculty members extends their influence or adds value to other departments, and in this case, the whole School of Medicine. So I want to congratulate, well, number one, Dr. Hensley for nominating Dr. Siegel. And two, I want to congratulate the committee for making such a wise decision and giving the award to Dr. Siegel. Congratulations. Back to you, Val.
Thank you so much, Mauricio. Really appreciate your sharing those words, and lots of congratulations and applause in our on our Zoom meeting here. Anyone else who would like to say any words? And please feel free to just speak up, because sometimes I can't see a hand or the hand raised. Thank you again, Donna, congratulations, and many years, and always so much of your work, as Paula was saying, is you're not one to speak of the many things that you've done for us. So I love these award celebrations, I have to say, because I feel like, first of all, I appreciate the people who take the time to see an award and think about someone that we can really acknowledge, that we can learn about, and that we can celebrate here, right? Because so much of here where we work and we live, a lot of us, and we do this work together because we care so much. I think just taking time to celebrate and bringing us together and learning from each other is just really something wonderful that we can do. So I appreciate these times, and learning some things that I don't know either about groups and people in our community. So saying in that, now we will go on to our next awardee, which Dr. Mingli Wang will share with us today about the AAMC inaugural for us here at the University of New Mexico chapter of Group of Women in Medicine and Science. So I'll turn it over to you, Dr. Lang. Thank you.
Thank you. As the president of the inaugural chapter of GWIMS, I'm honored to receive this Women's History Month Excellence Award on behalf of the GWIMS officers. For those of you who are unfamiliar with GWIMS, GWIMS formed at AAMC in 2009 with a focus of promoting women in science and medicine. And about a year ago, leadership at Office of DEI had a vision of starting a new chapter here at UNM. And our vision for the chapter is to support and promote the professional development, career advancement, and leadership of women faculty, staff, and trainees in medicine and science through education, advocacy, mentorship, and networking. And I like to think that we're on a good pathway with our first successful GWIMS kickoff event on March 15th. Over 70 registrants of faculty, residents, students, staff attended the talk by our Association of Women Surgeons signature speaker, Dr. Lumpkins, on envisioning your future. Dr. Gottlieb, the chair of GWIMS at AAMC, on her talk on pay equity. And there was a lively discussion on mentorship and promotions and networking at UNM. Many attendees were really grateful for the wisdom and advice. And I just want to quote one particular person, Dr. Bizzaro, who said she felt a great call to action and gave me hope for the future. So I thank the committee for this honor and recognition, promotion of DEI. But most of all, I want to thank the officers of GWIM's chapter who I can call my people, and all of them were so spectacular. And that's why a lot of them aren't here, because they're busy taking care of patients, doing research. I see Dr. Fritz here, who chairs like an NIH grant committee, and is also a mom, and also runs their fellowship program and mentors all these students and postdocs. And I know that all of them I just saw them selflessly volunteer their time on planning and delivering something great for the beloved community of women in medicine and science at the HSC. So it's that kind of spirit that I was really inspired me to nominate this group for this award. I'm just really thrilled that that we got picked. Thank you.
Thank you so much, Dr. Wang, and for the entire group. And Dr. Wang, and I know Dr. Fitz is here as well, and of course we want to open the floor for people. Will you mention the names of the leaders, your officer group as well?
Yes, Dr. Fritz is our secretary. Our treasurer is Dr. Sylvia Negretti, and our communications chair is Dr. Carolina Ponce. And we also have our student representative, Olivia Heath, and as well as our Catherine, you can help me if I'm forgetting somebody. I feel like I am. Shannon Clay, she's our resident fellow representative.
Great. Well, what an amazing group, and how nice. And thank you for bringing this to UNM to have our first chapter. As you said, I remember, because I go to the AAMC meetings every year, and having the GWIMs, because I just really appreciate their sessions and the information and everything that they bring, and always just, especially when they first came to be, I was just like, oh my gosh, how wonderful to have this, affiliate group here through the AAMC, a group on women in medicine. So to have our chapter here, I think is really wonderful. So appreciate that. And thank you so much, all of you. Catherine, I don't know if you wanted to say something as well, or anyone else, please. I'm opening the floor to you all. And of course, many things in the chat. So.
Yeah, I just wanted to thank Dr. Wang. She definitely has stepped up as our president. I think when we all took on the leadership roles for GWIMS, we weren't quite sure what we were getting into. And I think Dr. Wang has been our fearless leader, really taking charge of things and helping organize, obviously, the inaugural event, but also monthly meetings that I think have been really successful. Just bringing in different speakers to talk about their own journey in science and medicine. And so we can really learn from each other, how to be successful as women in leadership, but also in our own, little, career areas that we've chosen. And I think, the fact that there's a group of us that are working together has been really helpful, because, obviously everyone, as Dr. Wang mentioned, everyone is very busy. And so being able to count on other membership and also, you know, leadership within the organization to help us get our goals accomplished has been really good. And so I'm looking forward to the next year and having more of these monthly meetings and expanding, you know, our mission into mentorship and mentoring each other. Finding ways to network with each other, I think is going to be really exciting as the group grows. So thank you, Dr. Wang, for nominating us for the award. I think it's well deserved. And again, Dr. Wang has been great as our president.
Congratulations again. Very excited. And I believe Jim also dropped into the chat the link to join GWIMS for those who might want to. So thank you for that, Jim. Okay, we are going to move on to our next awardee, Dr. Lina Aguirre, who's an assistant professor in the School of Medicine, Division of Endocrinology and Metabolism, and also our VA Endocrinology section chief. And would like to welcome you to say some words. And I know Dr. Parada is here, our division chief for general internal medicine as well. So Dr. Aguirre, congratulations, and please, floor open to you.
Good afternoon. Can you guys hear me okay? You might have to forgive me, but I get emotional just to be taking part of this discussion. I am inspired to be in the same room with amazing individuals. And I know that we all represent a lot of people before us, family members, mentors. We're just that tiny little picture here representing many generations and efforts that other people might have been part of. So I wouldn't be here without those sacrifices and the support of all those mentors that have been before us. And I'm even more excited to be joining the new chapter of GWIMS and any effort to provide mentorship so that we're more and more represented at every single level. And before I tell you a little bit about my journey, I wanted to do sure that I wouldn't be here if I wouldn't have believed in myself and had been nurtured by strong figures in my life, including my mother, my grandmothers, and all those female role models that never had a voice or were never given a chance or could have a chance to pursue their professional dreams because they were not there even as a possibility. And I'm just enjoying this. Probably my mother is celebrating more than anybody else right now about how she sees in me what she would have loved to pursue, but she couldn't because of many reasons. And that's, I just wanted to say I'm very humbled that this journey is just beginning for me, because while it's not the beginning of my career, I am seeing myself as that mentor that was there for me when I was 7 years young, when my dreams began. And it could have ended to pursue any professions at the time, but it didn't, because those role models were there very early on for me. And with that, basically what I wanted to say is that my background is not very different than many figures, role models that I admire and I still admire in my life. I'm actually born and raised in a rural farm in Colombia, South America. And I was actually born to a teenage mother who had to make a living for the two of us really early in her life. And despite all of these changes and starts in my life, my mother was a rebel. She didn't accept that it was okay for her daughter not to have a chance to pursue any kind of education, despite having been born in a coffee farm at a really young age. And I really disliked that very much when I was an adolescent. And I certainly respect her even more and more by the days as I get older. I just cannot believe what an amazing person she was and she still is. And so are the other figures in my life, just like hers. When we moved to the United States, my mother really felt that anybody, regardless of their gender or their socioeconomic background, should have a chance to pursue any dreams. whatever those dreams would have been. And that's the reason why she felt strong enough to leave everything that she believed in behind for her daughter. And when we moved here, little did I realize that that was just the beginning of a journey for me and for her, for anybody that we interacted with. I would say that we went from having moved to the United States without knowing any language or skills or having any social training to saying we just believe in the future to be better for her. And because of that, here we are. So moving forward, I just wanted to say that all the role models that had been there for me from high school when I walked into the classroom, not knowing anything about what I was going to do for my life, except that I could do it and I had a mission to represent my mother's dream and where I came from. We're supported by very strong role models. Many were female figures in high school who believed in me and saw that passion and helped me through that so I could graduate and go to college when no one believed in me. It was the English as a second language course. It was the international group. It was this high school English teacher who saw in me the interest in learning and didn't give up on me and said, yes, you can do it if that's what you want to do. And after college, it was the figure in science and female figure role models who believe you can do this. I'm doing this. You can do it too. It's now your turn. I'm going to mentor you. It was that person that believed in me when I couldn't get into medical school that took me by the hand and said, if this is what you want to do, I've done it. And you don't have to be perfect to do it because I've done it and I'm here right now. I'm here for you. And as I get older, I realized that my major happiness is really seeing that person who is in my shoes at that time and being a role model for that person, regardless of how old they are, to say that you can do it too, and you don't have to be perfect. You don't have to be perfect in everything. I think the best role to say it is being imperfectly perfect human is actually my logo in life right now. And having heard that from my role models early in life was really helpful because my role models, what I thought the people that could be successful were people that had to be perfect, that couldn't make any mistakes or errors in their lives. And little did I know that reality is imperfectly perfect. We have no control about what happens, but we all have the right to have a dream and have a mentor to help us through that, especially if we felt that there was something that could have been done better or we didn't do perfectly. So I'm here to say that my major goal is to continue to contribute at all levels, regardless of what those are, to encourage anybody with my background or any background that is different to pursue their dreams, even if they don't think they're perfect or the perfect person to do so, especially in science and medicine and research. What that means to me, as far as the award, I really said that it means the world to me because I represent all these figures in my life that never had a voice or a chance to pursue their dreams for many reasons. And I see in them what they saw in me. I was their future. They would represent it in whatever we go in life, and to do that well and to do it the best that we can. But most importantly, to never let one of our team members with a dream give it up because they don't think they have a chance because there's no one like them that they could relate to or could serve as a mentor for them. So that's really kind of my background, and I it's not very special. Like I said, I'm very humbled to be here with you, and I'm looking forward very much to continue to serve back and make anybody that wants to become a we are, make that possible for them.
Thank you so much, Dr. Aguirre, and for that really very inspirational journey and talking to us about that and really bringing up again about those who come before us, right? And who often did not have the same opportunities as you said. And just really appreciate that sentiment and sharing that. And I think what you're saying, which I think we really all believe in, that our individual successes, right? We're recognizing, we're celebrating, but they're really collective endeavors, right? And we really do stand on those shoulders. So thank you so much for those really wonderful, like I said, inspirational words, and for, again, congratulations to you and your award today and the recognition of you, and as you recognize those who made this possible for you. And as you were saying too, you know, what about the future, right? Like we're here for those as well, to show that and to be there to help them along that path. So thank you for that. And I know, unfortunately, I think Dr. Parada had to step off to go to either her other meeting or clinic. And so I know she had wanted to share some words of congratulations with you as well. But I think we have many congratulations in the chat. And if anyone else wanted to say any other words, I'm just going to open the floor just for a minute here. If anyone else wanted to say anything. Okay. Everyone's liking the chat over here. So you're getting lots of kudos and congratulations there, Dr. Aguirre. And again, thank you so much and congratulations to you. Well deserved. So we're going to go on to, yes, you're so welcome. Our final awardees here. We're very excited to hear from as well our Community Health Workers Initiative. And thank you so much, Benice Ceballos, for your nomination. And I know that we have Jonique Lynch and Javier Rios here accepting the awards and sharing about, again, our amazing Community Health Worker Initiative. So I will turn the floor over to you all.
Thanks, Valerie. I just want to highlight that we have Myra Perez on the call too, as well, who's part of our senior leadership here at CHWI. I'm actually the one who submitted the nomination for our department because it is just such a unique environment that I have never been a part of before. Our department is made up of women, which is about 67% of our department. And within that, 15 of them have been promoted during their time at CHWI. And I am included in that, which is why I decided to submit this nomination, because I am just so grateful for the support that Venice, Javier, Myra, and so many others within CHWI have given me to grow professionally and personally as well. And just the fact that I am honored to contribute to that as well with the other people that I supervise, support within our department, but also through the community work that all of our programs do. We have, I believe, about 60 contracts statewide that we help through the community, through case management, outreach, and just so many other aspects. So I'm just really honored and grateful to be a part of CHWI, which is why I submitted the nomination. So, but thank you all.
Thank you, and for your nomination, taking the time to see this and nominate and lift and share with us. I think Javier and then Myra, yes, as well, always supporting so many and leading the way. Thank you for that. But if you all would like to say a few words, please. I know
Dr.
you all are
Liggett,
not shy.
Yeah, we're not
So
shy. We're
please.
not a shy group.
No, come on,
We
you're out there every
we-
day.
We planned like the order of how we wanted things. So I'll go ahead and start, and then I'll pass the baton on to Javier, and then to finish us off, it'll be Myra and Jonique. So we'll stick to our 10-minute time frame. So just a little bit of historical context. One, I'm Venice Ceballos, and I'm the Program Operations Director for Community Health Worker Initiatives, one of the many programs under the Office for Community Health. And I started at the university about 12 years ago. My journey started I was working at Project Echo, leading their community health worker programs. It started statewide, and then we moved globally. And then I transitioned to Office for Community Health. So I was fortunate enough and trusted with resources to build an organization. And for many of you that don't know what a community health worker is, these are people. It's one of the fastest growing professions in the healthcare setting as well. More recognition. Recently, community health workers were approved to bill Medicaid, which is a big deal in our state. And these are individuals simply from the community that represent the community. They know the language, they know the people. They many times are individuals who have lived experience. So same paths of life as the clients we serve. People are in recovery, some of the employees that we have hired. So peer support workers, and they're individuals that are experts at navigating social, legal, medical systems. And they master that so beautifully because they want to provide access and care to the communities that they serve. They're remarkable individuals that have a heart to do this for free. But of course, you know, these are paid positions. And within the university, as Jonique said, we have a big department that's been growing. And our philosophy is really to hire people that represent and look like the community. And we're very invested in that, but that's not always easy to do with certain policies and regulations in an academic institution. And I am an example of, I am a woman, Latina woman that has gone through a lot in life. And I was very determined that it was time for me to give back to my own community. And I fell in the CHW role. So 20 years ago, that's how I started, providing direct service, and have grown in a leadership role, which is not easy in an institution setting when you don't have a bachelor's, a master's, or a PhD. What I call my degree is to be a streetology degree, where you learn how to survive the streets, navigate them, and you advocate for them. We are very invested in that through community health workers, we can prevent and even reduce human suffering. And the populations that we work with is individuals with substance abuse, homelessness, that fall in the criteria with the social determinants of health. Our people are not in offices. They are out. You will see them out in the community. You'll see them, you know, walking the streets. They're at MDC. They're really out there. And the stories that clients share with us about how our programs are impacting and changing people's lives is remarkable. And I think we need to continue to support that profession, because they'll go and visit you at your home and bring you food if you don't have it, help you set up transportation, make sure you get to the doctor, whatever it takes to get you to be in a better place than you were today, or yesterday. So I'm going to pass this off to Javier, so you could tell us how we support women at our organization.
Gracias, Venice, and thank you, everybody. My name is Javier Rios. I'm the Strategic Support Manager at CHWI, and I just wanted to share a little bit about how in my role and at CHWI, we do support women and also plan to continue that. And I think one of the things, especially for myself as a male, is just acknowledging, you know, my own positionality and leveraging that and the influence that I can have for things like equitable pay and representation, especially in our leadership structure. Educating myself around issues that differentiate in the workplace, and also a lot of the inequities, especially pay inequity. CHWI has done an amazing job of not only advocating for pay equity for our community health worker and tribal CHR positions, which are predominantly run by women around the state, but advocating for things like flexible work arrangements, especially when people have families, and especially considering what has happened during the pandemic and post-pandemic, or COVID. And then also really, I think challenging, when staff may have sexist views or views that don't support women, like how do we do that in a way which is difficult to challenge those paradigms and fight for supporting the leadership we have. And just saying that it is a joy to work at CHWI. So thank you, everybody. And I will be passing to Mayra and Jonique.
Hi, everyone. Well, thank you so much. First of all, we would like to say thank you. And definitely this recognition really symbolizes a journey that we've all gone through as a department. There's definitely been some challenges and learning and countless moments of self-discovery. And so we all have, as mentioned before, right, around, this award definitely means people that have been very meaningful in our own lives. And especially for me, Dr. Mo, like I know you've been, I know we meet quarterly and really giving that support to one another. And I would not be here if it wasn't for the support that we've had within CHWI, and thanking Jonique, Venice, and Javier, and Dr. Shannon Sanchez Youngman. And so thank you. And I'll hand it over to Jonique.
I think my team has really just hit all the points, and I just want to reiterate how honored I am to be a part of CHWI, and I'm just really excited to see where our work continues and how we continue to work out in the community and within UNM. So thank you. We are all extremely honored to receive this award.
So again, congratulations. I will open it up to the floor, but I really want to thank you all as well for providing one of the most needed areas in the health and well-being of our communities, right? And as you said, at the level of the people that we work with, and really wanting to reflect the populations that we also serve. So we thank you for that really invaluable the work that you do, right? And it's also your passion and what you care so deeply about. So we thank you for that, absolutely. And again, lots of congratulations and hearts and all sorts of wonderful things in the chat right now. But any other words from anyone, please, if you have anything you'd like to share, I'm just gonna give a moment for you all. Okay, well, I would just like to again thank all of you for being here today in support and celebration of all of the amazing awardees that you have heard from today that do enhance the health and well-being of our community. And they do, and you all also have impacted the culture and the climate here in such a positive way for our health and health sciences. So we thank you so much for, again, your invaluable contributions that really do serve as an inspiration to all of us here at UNM, at the greater UNM, our health and health sciences, and really beyond, because that's what we are here for. So again, thank you for your inspiration, your amazing work, just everything that you've done. And for those of you who nominated and took the time to do that, I just thank you for that. And Amris Swan, which I don't know if Amris just went off camera here, where Amris went, but to thank her because she helps organize this and make sure we're set and gets everything set up, and just really want to acknowledge and thank Amris. And then of course, Jim helping us now too. So thank you, because we would not be able to even have these events without you, right? I mean, so thank you so much. And you all just have a wonderful, wonderful day, because this is a great way, like it's later in the day this time, or usually at a lunch hour or something, but what a great way, not that any of us are just like done now, either we may not be, but what a great way to end the day, right? And for me, like, it just gave me this new energy, and this lifted my spirit and soul here to have this. So again, congratulations to all of you amazing awardees and everyone who has supported you. Thank you.
Gina, go ahead. Gina, go ahead.
Gina, please, sorry.
Sorry, first of all, I want to apologize for coming late. I always like to come on time so I can hear about all of the amazing honorees. But I want to thank Dr. Romero-Leggett and all the team at DEI for bringing this together. This is an amazing event that gets to recognize, anything that recognizes the hard work that we do across campus, I think is well worthwhile. So thank you for doing that, guys. And Dr. Zadonis did have this on his calendar so he could pop in, but he's across the country in California and has some connection problems. And so we were on a call, and then real quickly he was like, we're supposed to be on this thing and I can't connect. And So I jumped in real quick, but on behalf of Dr. Zadonis and all of us here at the EVP office, I want to say a heartfelt congratulations to the honorees. You join a group of others before you and many who are joined with you in the work that you do. So thank you so much. Congratulations. And we celebrate you today. Thank you.
Thank you so much, Gina. And thank you, Everest, for catching that. Gina, I thought you were waving and then you were. It's like, wait, I want something to share. That was a great way to end for us today. And we do appreciate Dr. Zaidonis trying to join us as well. Thank you all, and you have a wonderful rest of your day and evening and week. Thank you.
Thanks,
Take
everybody.
care. Thank you.